It's unanimous. Ontario's 34 medical officers of health are calling for a provincial vaccine passport system, and we are learning more about what individual regions are considering if the provincial government refuses to take the reins on this.
We are in the very early exploratory phases of trying to understand what our jurisdiction might be.
Peel Region's public health unit is now working to get a proof of vaccination program off the ground. Dr. Lawrence Lowe says it's a necessary tool to help get a handle on what's to come.
Certainly we are communicating with other health units that have expressed an interest in this, but I think our big focus is really, at least for us in Peel, a recognition that our community has bore the brunt of this, and we certainly don't want to see a return to broad closures.
While a patchwork system is being called a last resort, York Region's top doctor says the fourth wave is here and the clock is ticking.
In York Region, for example, are finding that 8 out of the 10 cases that we see are in either unvaccinated or partially vaccinated individuals.
So let's say the province does not budge on this. Is York Region having its own system, and Peel Region and Toronto having their own systems, or will the GTA come together on this?
So we are already exploring systems. There are a number of apps available on the market, and we're exploring these. However, any movement forwards, we would prefer to be in alignment with our colleagues in the GTA at the minimum.
Details are still vague on how this could all roll out. Toronto Public Health will only tell us it will continue to advocate for a provincial system. And that is a consensus after Ontario's 34 top doctors had a meeting yesterday.
Isn't it better we should all have the same one with the same consistent information? And the best people to provide that is the provincial government. They have the vaccine information, they have responsibility for healthcare, education and employment.
And despite mounting pressure, the government is not budging. The Minister of Health's office telling us once again today that the receipt you get after your shot is all the proof you need. But Mississauga's mayor says it's not good enough.
The current receipt that people receive after vaccination contains personal and private information, including your date of birth and your health card information. These receipts can be easily manipulated and falsified. The technology we're seeing implemented in other jurisdictions is simple and it's safe.
With September and back to school just around the corner, all we've been told is that it could be a grim fall and winter. As we wait for the scientific modeling to show us what that means, Dr. Kurji tells me the Delta variant is a game changer, and he is concerned the hospital system is once again in jeopardy.
There is every reason to suspect that we would be faring just as badly this time around as we did in the third wave.
And according to Dr. Kurji, a regional system could be up and running in a matter of weeks, while Peel Region would not give a timeline. The hope still is that the province will step in. However, the Minister of Health's office did not answer any of our questions about this. Instead, we got exactly the same response they sent us yesterday.